Have migraine? We have some hopeful news for you. The American Headache Society just released a white paper in the Headache Journal stating that CGRP inhibitors should be considered a first-line migraine preventive treatment. So what does this mean? The intended audience is insurance providers. So imagine that this is a letter written to insurance providers, providing a recommendation on how CGRP inhibitors should be regarded going forward. On Instagram, the American Headache Society said, yesterday, AHS published a new consensus position statement in the Headache Journal about the first-line role CGRP targeting therapy should play in the prevention of migraine. Specifically, the AHS calls for CGRP targeting therapies to be considered as a first-line approach for migraine prevention, along with previous first-line treatments, without a requirement for prior failure of other classes of migraine preventive treatment. What they're saying is that they don't think that patients should have to go through step therapy to qualify for CGRP inhibitors. Step therapy is when insurance requires a patient to unsuccessfully trial at least 2 first-line treatments, typically less expensive medications, before they qualify for newer, more expensive medications. While step therapy is a cost-saving measure, it doesn't save money in the long term because fail-first protocols delay needed treatment and increase patient costs via emergency room and doctor's visits. Additionally, step therapy may introduce a patient to medications that can complicate their migraine disease, like opiates or Fioricet, which again can hurt the patient's long-term outcomes. The AHS statement is helpful because headache specialists and other providers now will have something to send to insurance providers when appealing medication denials. The statement outlines that CGRP inhibitors should be considered as a first-line approach for migraine prevention, along with previous first-line treatments, without a requirement for prior failure of other classes of migraine preventive treatment. Simply put, it means that the AHS believes that CGRP inhibitors are an appropriate medication to trial at the beginning of your migraine diagnosis, without needing to try older medications first. Now, let's hope that insurance providers listen.